While Gauteng province is still reporting the highest number of new cases per day, the numbers have risen rapidly, especially in the coastal provinces, but all 9 provinces have seen a rise. And this is resulting in where, as of yesterday, for instance, Gauteng accounted for only 25% of new infections. Now, this is compared to around 7 to 10 days ago, where Gauteng was accounting for 70 to 80% of the new infections. The number of cases in the 4th wave have exceeded the peaks of the 3rd, the 2nd, and the 1st waves, with a weekly average new infections of more than 37 per 100,000 of population, while the peak of the 3rd wave was at 33 per 100,000. So 37 already now in this 4th wave, when at the highest of the 3rd wave, it was 33 per 100,000 of population. In the 2nd wave, just a little below 32 per 100,000. And the 1st wave was even much lower in its peak at 21 per 100,000 of population in terms of new infections on an average weekly basis. The positivity rate has also risen steeply across the country, and with yesterday's average positivity rate of 31%. 8 provinces yesterday recorded a positivity rate of 30% or above, with only Gauteng, which used to hover around 35%, but it was the only province yesterday which was below 30% of positivity at 25%. In the last 7 days, new cases have increased by an average of 37%, with Eastern Cape, Free State, KZN, Western Cape, and Northern Cape having been showing more than 100% increase in daily new cases compared to 7 days earlier, which confirms a rapid increase nationwide. Active cases as of yesterday were standing just over 210,635, which is 10% higher than the last 24 hours. Good news is that the recovery rate is still very good, currently standing at 91%. The health department will advise the NCCC in the next few days as to whether we should review the restrictions, as we announced just yesterday that the last NCCC has decided to remain at where we are, but we have been tasked as a health department to continue to monitor the situation and report back in the coming week. If we all do our part, we can still enjoy a good festive season. It is in our hands, and there's an opportunity for us to make sure that we can have an enjoyable but very safe festive season. Above all precautions, as I've mentioned, we should get our jab before we go on jolling. So jab before you joll and jab before you jive.